I'm here with Dr. Bruce January, one of our world-class surgeons who has treated over 112,000 eyes. And we're here to answer some questions or talk about some myths about LASIK. So first, 112, is that even real?
I know it is, and it makes me feel really old. But the most important thing is not what I've done in the past, it's the next two that I do. So I always think of it's the next two that are most important.
Fantastic. So first question, this is a very common one. Does LASIK cause dry eye or make it worse?
That's a great question. We know that LASIK makes it so that you're more aware of your eyes immediately after surgery. When you measure basal tear secretion and the amount of tears you produce 6 months out, it's the same. So there is a momentary dip or decrease in the amount of tears produced. There are some people who have lasting dry eye, but typically with great pre- and post-operative care, we can minimize that as a problem.
Fantastic. Now, is there an age range for LASIK?
I say the sooner the better. As long as you have 2 years of stable prescriptions, I think you're actually doing yourself a service because you're saving so much money by doing so. In other words, if you're 18 and your prescription and you're -3 and it hasn't changed in 2 years, by all means do it. If your prescription were to change, say when you're 24, the small amount of corneal tissue is required to improve that. It's certainly possible to do. So I would say it's actually in your benefit to do it sooner rather than later.
What about on the latter end?
As long as there's no cataract, and even people after cataract surgery can have LASIK or PRK, and I've done that successfully. The oldest person I operated on, I think, was like 78, but they had a clear intraocular lens, they had some astigmatism, and cleared that right up with surgery.
Awesome. So how long does LASIK last? Going off of that, point that you were making, the sooner the better.
Yeah, some people think that LASIK has a timeline for some reason. I've heard something like 10 years. The truth is, for most prescriptions, it lasts a lifetime. For people who have farsightedness, there can be more variance in their outcome. But for people with simple prescriptions, typically the likelihood of an enhancement nationwide is around 10%. In my practice, it's less than 3%. And it has to do with the difficulty of the prescription to begin with. So that's a great question for your eye care provider because it varies depending on how difficult your prescription is and your age.
Fantastic. So here's a myth. LASIK can't fix an astigmatism.
Oh, absolutely not. And the reason is that lasers, quite honestly, weren't as good as treating astigmatism as they are now. In the past, lasers, we take all the measures with people sitting up, and then what happens is when you lie down, what we didn't realize is that I can rotate on the Z-axis. Now our treatments actually rotate with your eye, and even if your head moves during surgery, that laser is put exactly on that axis. So
here's another one. A LASIK flap never heals. True or false?
I would say mostly true, and the reason is because the only thing that heals is the edge of the flap, and that's actually a strength and not a weakness. You don't want collagen cross-linking in the interface because that would be haze or scarring in the cornea. So with LASIK, no scarring. That's a beautiful thing. And also that ability to lift the flap in the future is like a window into your eyes. You could always go back and adjust the prescription if need be.
If you're in that minority that you discussed.
Absolutely.
All right, well, thank you today for your time, Dr. January.
It was a pleasure.
It was a pleasure on our end.
So cool.
We hope that you found this helpful. If you would like to meet one of our world-class doctors, such as Dr. January, or would you like to come into one of our vision centers and to shadow, please give us a call at 513-358-5858.